Today we're diving into a big, serious topic, cancer. I know just hearing the word can be scary, but knowledge is power, and when we talk about cancer, understanding what it actually is and the different forms it takes is one of the best ways we can arm ourselves. Now, if you look up cancer, you'll find there are literally over 100 different types. That's way too much for one video. So, instead of trying to memorize every single one, we're going to focus on the 4 main families of cancer. Understanding these families gives you a clear map of how and where cancer can start in the human body. Think of it like this. Instead of learning every model of car ever made, we're just going to learn about the 4 main vehicle types: sedans, trucks, SUVs, and vans. Ready to learn? Let's break down the world of cancer, simply and conversationally. Part 1. What is cancer? The big idea. Before we get to the types, let's nail down the basics. What exactly is cancer? At its core, cancer is a disease of uncontrolled cell growth. Our bodies are constantly making new cells to replace old ones. It's a highly organized, balanced process. Think of it as a factory with very strict quality control. But sometimes, a cell gets a mutation, a typo in its DNA instructions. This typo makes the cell ignore all the normal stop and die signals. It starts multiplying out of control, like a car with a stuck accelerator pedal. When these bad cells clump together, they form a mass, which we call a tumor. And when those cells gain the ability to invade other surrounding tissues or travel to distant parts of the body, that's when we call it malignant or cancer. The different types of cancer we're talking about today are defined by where those original abnormal cells came from. That starting point is crucial. Part 2. The 4 major families of cancer. There are 4 big families, or categories, that most cancers fall into. They are carcinomas, sarcomas, leukemias, lymphomas, and a close relative, myeloma. Let's go through them one by one. Family 1. Carcinomas, the liners and coverings. Let's start with the most common family, accounting for nearly 90% of all cancers, carcinomas. The word carcinoma comes from the Greek word for crab, but the key thing to remember is where they start: epithelial tissue. Epithelial tissues are the cells that line and cover things. They cover the outside of your body, that's your skin, and they line the inside of all your organs and glands, like your lungs, breast ducts, colon, stomach, and prostate. They're essentially the protective wrapping and lining. Because these tissues are so widespread and are often the first things exposed to the outside world, or to chemicals, this is where cancer most frequently takes root. The most common cancers you hear about fall into this group: breast cancer, lung cancer, prostate cancer, colon cancer, skin cancers, like basal cell and squamous cell carcinomas. If you hear the name of an organ followed by the word carcinoma, like renal cell carcinoma, kidney, or hepatocellular carcinoma, liver, you know what family it belongs to. Family 2. Sarcomas, the connective tissues. Next up are sarcomas. These are much rarer than carcinomas, but they're important. Sarcomas start in the connective and supportive tissues of the body. Think of everything that holds you together and gives you structure: bones, muscle, fat, cartilage, blood vessels, basically the stuff between the organs. They are classified into 2 main groups: bone sarcomas, like osteosarcoma, which often affects young people; soft tissue sarcomas, like cancers of muscle or fat. A key difference is that while carcinomas often start in older adults, some sarcomas are more common in children and young adults because they are associated with growing tissues. It's less common to see a cancer in this family, but it's important to know that cancer isn't just a disease of your organs. It can also affect the very scaffolding of your body. Family 3. Leukemias, the liquid cancer. Now, let's move away from solid tumors and talk about the cancers that affect your blood. Leukemias. Leukemias are a cancer of the blood-forming tissues, usually the bone marrow. Bone marrow is the sponge-like material inside your bones where all your blood cells, red cells, white cells, and platelets are made. In leukemia, the bone marrow starts producing a huge number of abnormal white blood cells. These cells don't mature or function correctly, and they crowd out the production of healthy blood cells. Because blood flows everywhere, leukemia is considered a liquid cancer and usually doesn't form a solid tumor mass. Leukemias are often classified as acute, fast-growing, or chronic, slow-growing, and then by the type of white blood cell they start in, like acute myeloid leukemia, AML, or chronic lymphocytic leukemia, CLL. This is the most common form of childhood cancer, though it affects adults too. Family 4. Lymphomas and myeloma, the immune system cancers. Our final major family is the cancers that start in the immune system: lymphomas and their close relative, multiple myeloma. These start in your lymphatic system. Think of the lymphatic system as your body's internal drainage and defense network. It includes your lymph nodes, your spleen, your tonsils, and a network of vessels. Its main fighters are a type of white blood cell called lymphocytes. Lymphoma is cancer of the lymphocytes. When these cells start multiplying out of control, they often cause cause the lymph nodes to swell, which is one of the most common first signs. The two main types of lymphoma are Hodgkin lymphoma, distinguished by the presence of a specific type of abnormal cell called a Reed-Sternberg cell. It's often highly curable. Non-Hodgkin lymphoma. This is a much broader group of all the other lymphomas. Multiple myeloma is a closely related cancer. It starts in a different type of immune cell called a plasma cell, which also lives primarily in the bone marrow. These plasma cells are normally the ones that make antibodies to fight infection. But in myeloma, they grow out of control and start damaging the bone. Part 5. The other categories: melanoma and central nervous system. While the big four cover most cases, there are a couple of other important categories that get their own classification because they come from very unique cells. Melanoma. This is a type of skin cancer, but it's treated separately from carcinomas because it starts in the melanocytes, the cells that give your skin its color, pigment. Melanoma is known for being more aggressive and having a greater ability to spread than the other common skin cancers. Central nervous system cancers. These are tumors that start in the brain and spinal cord. They are classified by the specific type of nerve or supporting cell they start in, such as gliomas or meningiomas. They are unique because their location in the restricted space of the skull and spine often causes symptoms more quickly. Germ cell tumors. These are cancers that start in the reproductive cells, such as testicular or ovarian cancer. Part 6. So there you have it. The world of cancer boiled down to its main families. You have carcinomas, the most common, starting in the linings of organs in the skin; sarcomas, the rare ones, starting in the supportive tissue like bone and muscle; leukemias, the liquid cancer of the bone marrow and blood; lymphomas, the cancer of the immune system's defense network. Why is this breakdown important? Because a cancer's family, its origin, largely determines how it behaves, how it's treated, and what tests are used to find it. A lung carcinoma is treated differently from a bone sarcoma, even though they are both technically cancer. Understanding these core concepts allows you to better understand the headlines, talk to your doctor, and feel more in control of a very complex subject. Remember, early detection is key for virtually every type of cancer. Be aware of your body, listen to any persistent or unusual symptoms, and never hesitate to talk to your healthcare provider. If you found this video helpful in simplifying this topic, please give it a thumbs up and subscribe. What other complex health topics do you want me to break down? Let me know in the comments below. We'll see you next time. Stay healthy.